Mm.
Hello, I am Dr. Vishwas. I am a doctor of this clinic. May I confirm your name and age, please?
Yes, I am Mrs. Lisa Ray, 65 years old.
Okay, Mrs. Nice to meet you. How can I address you?
You can address me as Lisa.
Okay, Miss Lisa. I have got a letter from your GP saying that you have lost your weight for last few months, and also on examination you have low blood level. Is it right?
Yes, doctor. That's right.
So I am going to discuss about your condition, and during our conversation I may take some note, but all the information during our conversation will be remain confidential. So is it all right for you?
Yes, doctor. It's all right.
So can you please tell me in your words what is happening with you?
Well, doctor, actually, for the last 6 months, I think I have been losing weight, and there is no change in my food habit. I have been eating same amount of food, but I think I have lost around 1 stone of weight. Okay, during the last 6 months. So that is really bothersome for me. And also, I feel that uh, recently I feel that my tummy is getting full after having a little amount of food. Okay, so it's been for the last 2 or 3 months that I am feeling that my tummy is getting full after eating small amounts of food. And previously, I had some condition with my food pipe. Okay, and after that, I went to the GP. That was around 4 years back. Okay, sorry, 5 years back. So at that time, he did some tests and gave me one tablet, actually, one capsule, which and since then I have been taking it. But and now I feel that some of those symptoms that I had at that time, like sometimes I feel some sour taste in mouth. Okay, and sometimes some discomfort in my chest. So these things are coming back, and also I'm feeling full in my tummy. So I'm getting a bit worried, doctor.
I am extremely sorry to hear that. And you said that you lost weight without any intention.
Yes.
Okay. And with this, do you have any feeling of nausea or feelings of sickness?
Doctor, sometimes I also feel that I would like to vomit, but there is no vomiting actually. Okay, but yes, at times I feel a bit nauseated.
Have you ever vomited?
No, doctor, there is no vomit. Sometimes I feel that it would be better to vomit, but no vomiting.
And you said that you can eat like before, but with less amount of food, you feel stuckiness in your chest.
Not stuffiness actually, doctor. I think that I'm getting full after eating small amount of food.
Uh,
Okay.
you get early satiety after taking food.
Yeah, doctor.
After taking food, do you feel any tummy pain,
Not significantly, doctor.
any
But
discomfort?
while taking food, at the time of taking food, okay, at times I feel that there is some problem in my swallowing. Okay, but not that much after taking food.
Okay, so what do you mean by problem in swallowing?
Yeah, I think that sometimes uh, I when food gets stuck in the food pipe. Okay, near my neck. Okay, in the midpoint of my neck. Okay, sometimes.
Is it happened
So
with both solid or liquid food?
I think it's more with solid foods.
And do you need to take any water or any other help to pass it?
Yeah, I feel better by drinking some water. Okay.
And do you feel all kind of solid food or just meat or anything else?
I think most solid foods cause some disturbance.
Have you ever regurgitated food?
So I think 1 or 2 times food came through my mouth. Okay, at night, but nothing else. And there was some sour taste.
And Are the food that come at night, are they very foul smelling?
At times, because but I actually didn't know because there was no one accompanying me at that time. About the smell, I just couldn't realize that much. But the taste was sour.
For how long you are having this?
Uh, all these problems, actually, the first problem was about weight. So then I think the other problems are around for 3 to 4 months.
Okay. And do you cough at night?
No, I haven't noticed like that.
And you said you don't have any tummy pain, but do you have any problem with your bowel habit?
No, doctor, it's quite okay.
Have you noticed any black stool or any reddish stool or
No,
large?
no, no, doctor. No, doctor.
How about your water work?
It's quite okay, doctor.
Do you have any headache?
No, doctor.
Any changes in your vision?
No,
Any rash anywhere in your body?
no.
Any weakness at any side of your body?
No, doctor. I haven't noticed.
Any generalized weakness?
No, not that much, but still I'm losing weight. I'm getting a bit frustrated. So I get a bit uh, tired or what you can say, but nothing significant.
Do you have any chest pain?
At times, doctor, at night, I told you that I have some discomfort in my chest. Okay.
Can you describe the pain?
Well, actually, I think it's just the mid of my just lower chest. Okay, just near my tummy, just upper tummy, near it. So usually, I sometimes I have to belch. Okay, and when I belch, I think it gets better. This pain, and that's all. I think, and it's very sharp, something like that. A very dull pain. Okay, that sometimes is present, but nothing. Nothing very serious, nothing very stabbing or like that, nothing like that. Very dull pain at times.
Okay. And do you have any lump anywhere in your body?
No, I haven't noticed.
Any soiling or any lump in your tummy?
I haven't noticed.
Any joint pain?
No.
Okay. Then you said that you have been diagnosed with some problem with your food pipe 5 years ago.
Yeah, yeah.
Do you have any document for that?
Well, I don't have that document, but mm, uh, well, but I think he told that I had some type of infection. Okay, in my food pipe, and later on he gave me some. What do you know? I think some omeprazole. I think, and I have been since then. I have been taking it on and off, and I was quite well till the last 6 months back. Okay.
Okay. And do you have any other medical history or any other disease that you would like to share?
Nothing, doctor.
And may I know that with except omeprazole, are you taking any other medication?
No,
Any over-the-counter medication?
no,
Any herbal products?
no,
Yeah. Do you have any allergy to any medication?
no, doctor.
I'm sorry to ask, but can you please tell me that do you take any IV drugs or have you taken?
No, 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 no.
I'm sorry to ask. And do you, your family member or any of your family member have this type of symptom?
No, doctor.
Any history of cancer in your bowel? In your,
Yes, yes, doctor. I was just going to tell about that. Actually, my mother and sister both had some breast cancer. Okay, so they had suffered from it.
I'm sorry to hear that. May I ask you a few more personal questions?
Yes,
Do you smoke cigarette?
no, doctor.
Have you ever?
No, no.
That's fine.
I want to try to live have a decent life. Okay.
Okay, I appreciate that. Do you drink alcohol?
No, no.
Okay, that is fine. May I know that what do you do for a living?
I am a school teacher. I was a school teacher, but now I am a retired person.
And do you can you manage your uh, economic condition yourself, or do you need help?
No, I think that I can manage. Okay,
Okay, that
because I get some social security network, and I think it's quite good.
I am just asking it. Do you have any history of recent travel?
No, no.
And whom do you live with?
Actually, doctor, now I live alone. I had my husband, but he is no more,
Sorry to hear that.
and I have two children. They live outside. However, they take care, good care of me, and at times they come by to visit me, and I'm happy.
Okay. And at this point, do you want to add anything?
Well, doctor, not adding anything, but you know that my mother and sisters both had some issues, health issues, some cancer. So I'm a bit worried that whether I'm also getting involved in this cancer thing or not. And I'm also getting old. So it's a concern that's bothering me. What do you think?
Yeah, I can understand your concern. Before I answer, may I know that how about your mood?
Mood, it's quite or less okay, doctor.
Yes, I have taken your history. I need to examine you properly, then I could give you the best explanation. But as far as I have taken your history, as you have history of weight loss, and also you have low blood level, and also you have a history of changes in your food five about 5 years ago. This brings a few possibilities, and I am afraid to tell you that we cannot rule out exactly that you have cancer or not. For this, we need to do some imaging test, some camera test of your food pipe again, and also we need to do other imaging test of your chest and tummy, and after that, I can give you the answer that what is happening with you.
Okay, okay, doctor. And regarding its cancer, if it's a cancer, is there any treatment present?
Uh, I can understand that you are worried, but please allow us time, and we are going to do this test urgently so that we can get that exactly what happened to you, and after that, I can we can make arrangement that what is happening with you, and we can give you the treatment plan.
Oh,
Time off.
okay.
Do you have any other?
So no, doctor, no, doctor. So what are your duties here?
For this lady, along with her history, my differentials are this can be a case of gastric outlet obstruction due to uh, carcinoma of the stomach, or due to chronic peptic ulcer disease, though she has no history of uh, abdominal pain. And I also consider stricture esophagus. Then I will also consider carcinoma of the esophagus.
Well, so what investigations do you think you should run?
For this lady first, I will go for barium swallow and barium meal. It's along with the routine blood test. I will go for the barium swallow and barium meal X-ray, and after that, I will go for the endoscopy of upper gastrointestinal tract, and if needed, I will go for the biopsy. And in the meantime, I will also consider a chest X-ray.
Okay, okay, okay. That's all right. And okay. and I think you have fared well in this case. And since actually there are some symptoms actually present, okay, what we see the alarm symptoms like loss of weight, anemia, okay, and some other symptoms that are involved. So these symptoms, since these symptoms are present, it is very much important to rule out carcinoma. Okay, anemia, loss of weight, abdominal mass, recent onset of progressive symptoms, melanoma, hematemesis, dysphagia, or vomiting. Actually she had some, okay, like anemia, like some loss of weight. These are something. But another thing is that I think it was told that she had some anemia, but you didn't actually go very deep, I think, into that the symptoms, that whether any chest pain you excluded, but a shortness of breath, any leg swelling on thing, I think that could have been asked in a short, I think. Okay, and others you actually excluded very well, and I think it was quite okay. Yes, and it was quite okay. And again, in when I told that she had some issues 5 years back, you could have asked some more. Just besides asking her report, I think uh, you could have asked that what brought out those symptoms. Can you remember on things? Remember anything? I think that could have been asked. Okay, because that esophagitis can also be caused by some infective issues. Okay, yeah. So whether at that time she had some infective causes or not, I think that could have also been asked. Okay, and okay, and I think otherwise it has been a very good performance. So thank
And
you.
for this lady, I think taking food habit or taking dietary history was important, I think.
Yes, because there are some types of food, that can cause that can predispose to carcinoma. That is this food habit, dietary food habit, vegetables, fruits, and what about red meat? Okay, and pickles food. I think some canned food. These things are, and some dried fish. Sorry, seafood fish. Okay, sea fish. So I think this could have been asked. Okay.
Okay. Is there any
So
relation with family history of carcinoma of breast?
no, I haven't found any. Okay, but I haven't found any. But it was actually just it was a concern issue. I think that since uh, both one of the parents and siblings had carcinoma, so she was more concerned about it. I think that's the issue here.
Okay, thank you.
Thank you. Okay.